Today we're going to be running through rapid diagnostic tests using Tamanu Mobile. This is functionality that has been prepared for the Fiji Ministry of Health and Medical Services, and it's very, very similar to the functionality that we have been implementing for several months in Fiji already. Previously, if you just did a rapid diagnostic test on a patient, however, and didn't send any swab sample up to a lab, there was a slightly different workflow for how that was submitted. That was entered via the form rather than entered as a lab request. That's made reporting a little bit tricky because the data is reported in different ways, and it's also a little bit more difficult to train on because it's a slightly different workflow for the different examples. So we have now standardized this across the system, and it's the same workflow now regardless of whether you're doing a normal lab request or a rapid diagnostic test. This is going to be available immediately in Fiji. If you need more training, please contact someone via the Viber groups or get in contact with the CDC. We're happy to do refresher trainings as often as possible, but we're making this video available for people who can't join any of the times. This functionality will also be used by hotels and tourism operators who are conducting rapid diagnostic tests on tourists coming into Fiji. So there's 4 scenarios for COVID-19 rapid diagnostic tests. The functionality that we're also going to be showing today is when you don't do a rapid diagnostic test, when you just jump straight to a swab that gets sent off to a laboratory. So in some ways there are 5 scenarios, the first scenario being a swab with no RDT. If you do an RDT, there are then 4 possibilities. 1, the patient is positive and they're from a symptomatic or a high prevalence area. That means that the patient is then presumed positive, and that just needs to be entered. There's no further testing for the patient. The second one is the rapid diagnostic test is negative and the patient is low risk and or asymptomatic. In that case also, they are presumed negative and no further testing is required. You don't send any lab swabs off. The third scenario is that the RDT is positive, but the patient is asymptomatic and or it's a low prevalence area. In that case, you get sent off for confirmatory testing with a swab sample. The patient still has to isolate and follow all the management protocols until that result comes back, but there is a confirmatory test that is sent off. And the fourth scenario is that the RDT is negative, but the patient is symptomatic and or high risk. In which case that's also sent off for confirmatory testing. So we're going to now open up Tamanu Mobile. All of you would be familiar with this screen if you've used Tamanu Mobile before. If not, there are longer trainings available online in order to show you how to use the basics of the system. But for those of you who haven't seen it, this is what your screen looks like when you log in. You can search for patients here, view all patients, and you can use the filters here to narrow down your search for patients. We will enter some data against Noah Alonso today and walk through those 5 scenarios. So we'll really quickly run through the first scenario, but that is completely unchanged. If there's no RDT done, you enter the programs module and you go to the COVID-19 sample collection form. Now this list of surveys looks really messy in this environment because this has all of the program surveys that we do across different countries. In Fiji, of course, there's not that many surveys, so COVID-19 sample collection form is easy to find. If you select the sample collection form, you then just work your way through and answer the questions. Yes to consent, contact number, and the subdivision where the patient's located. Now those 3 questions are compulsory, or mandatory I should say, so you need to fill them in, and we've changed the order of them around a little bit so that they're a little bit more obvious. Now I'm not going to go through and answer all of the remaining questions on this survey, but we do ask that staff complete all of them. There is a different survey for hotel operators and tourism operators in Fiji that we'll come to later. You then get to this question: have you conducted a COVID-19 antigen-based rapid diagnostic test for this patient? In the first scenario, we're going to say no, okay? If you haven't conducted one, you simply continue completing the form and then you complete a lab request in Tamanu. So you go through answer each of the remaining questions. Again, we're going to skip all of those and submit your survey. As you can see, we've been playing around a little bit with Noah Alonso before. Obviously, you won't see that many sample collection forms for a single patient. You then come out to lab request. And you can see we've done a ton of requests for Noah Alonso, but you click new request. It then generates your unique lab request number, which you give to the patient. You select the priority, which is really why is the person being tested. In this case, we'll say it's a screening test. The date, time, and the lab request type. And of course, this is a COVID-19 swab. Usually it's a nasopharyngeal swab. And you submit that. So that workflow hasn't changed. You can see there that that's syncing. As we always say, make sure you sync that data as often as possible. It will automatically sync, but if you turn off your phone or even if you close the app, automatic sync doesn't work on Android devices. So we always remind people to just manually sync as often as you can. So that workflow is unchanged. That's if you haven't done an RDT. But now we're going to work through the 4 scenarios where an RDT has been done. So the first scenario is the RDT is positive, the patient is symptomatic, or it's a high prevalence area. Okay, so we go to programs, COVID-19 sample collection form. Always complete the mandatory questions. Always fill in the subdivision because it's really important for reporting. And that's a subdivision where the patient has spent the most time in the last 14 days. And then go through and answer the rest of the questions. Now, for the sake of time, again, we're not going to fill in all the questions until we get to here. So for this patient, have you conducted a rapid diagnostic test? We're going to say yes. And this time there's no further questions about RDTs in the survey. It simply gives you the instructions. So in this case, if the result is positive, please ensure you complete a lab request in Tamanu to record the positive result, instruct the patient to follow isolation and management protocols. You still go through and complete the rest of the form, but there's no more questions about rapid diagnostic tests. We get to the end, you submit. Now we come back out and we complete a lab request. Again, go to new request. Again, you get a unique ID, a unique lab request number, which you give to the patient. But now we're going to say that this is RDT positive, no further testing needed. So where you enter effectively, why are you doing this test? You enter that in the lab request. Okay, so even though you are not sending a lab sample off to a laboratory, you are still going to fill in a lab request, and you're going to do that for every single patient now. You can mark that the specimen, is attached. You can actually leave that as no. The date and time of the test, you do need to fill in. And then you here enter that it is RDT positive, no further testing needed. Okay, that is a presumed positive, and that will now be reported on as a presumed positive. And we don't need to do anything more. I mean, other than, as we always say, sync the data manually. The second scenario, if you've completed an RDT, is that the result was negative and the patient is low risk and or asymptomatic. So again, open the program survey, go to sample collection form, fill in the mandatory questions. Again, I'm going to be repeating myself quite a lot, but you can skip. I'm going to skip these questions, but you should fill them in. Have you conducted a COVID-19 rapid diagnostic test? Yes. In this case, the result is negative and the patient is asymptomatic. Please ensure you complete a lab request to record the negative result. Okay, so it's giving you the instructions there. Fill in the rest of the questions and submit the survey. Now again, you need to fill in a lab request. So it's always the same. Fill in a program survey, fill in the lab request. We're going to go new request. There's a lab request number to give to the patient. And in this case, where we select priority, we're going to say RDT negative, no further testing needed. We capture the date, we capture the time. The lab request type is COVID-19 swab. And down the bottom you can see RDT negative, no further testing needed. And you submit that. So we're hoping that it's always fairly self-explanatory, that you're just filling in the most obvious answer in all cases. And as we say, always doing the same workflow. Okay, the third scenario, if you've done an RDT, is that the patient is positive, but they're asymptomatic or it's a low prevalence area. So you want to send it off for a confirmatory test. Again, go to the program survey, go to the sample collection form, fill in the mandatory answers, fill in the rest of the questions, and when you get here, select yes. Have you conducted an antigen-based rapid diagnostic test? We say yes. The patient is positive, but the patient is from an area of low prevalence. Please ensure you take another sample and create a lab request in Tamanu. This sample will be sent to a laboratory for testing. Instruct the patient to follow isolation and management protocols until they receive their result. So this patient is presumed positive until they get their result. Fill in the rest of the questions and submit your survey. Now you come out and do your lab request. So you've done your sample collection survey, now you do your lab request. New request, give the lab request number to the patient so that they can search using the online widget. We come out to here and we say that the RDT was positive, but further testing is needed. Okay, that is the reason for this test. We select that. In this case, the specimen is going to be attached. You can select the date and time. And we're going to say lab request type COVID-19 swab. But in this case, we enter the test type that we are actually doing for our confirmatory test. So in this case, we're sending off a nasopharyngeal swab. So when there's no further testing needed, you can select one of these two options down the bottom. But in this case, this is a confirmatory test that is being sent to the lab, and we're selecting nasopharyngeal swab. So we're going to submit that, and off that goes. Again, always try to remember to sync after you've done a test, or at least every few minutes. The fourth and final scenario, if you've done an RDT, is that the RDT is negative, but the patient is symptomatic and or high risk. And so you want to send that off for a confirmatory test. And in that case, again, select programs, select COVID-19 sample collection form, fill in the mandatory answers, fill in the rest of the answers. Have you conducted a COVID-19 antigen-based rapid diagnostic test? Yes. And in this case, the result was negative and the patient is symptomatic and or high risk. Please ensure you take another sample and create a lab request in Tamanu. This sample will be sent to a laboratory for testing. So again, it's giving you the instructions. Select next page, make sure you fill all these in. It's really important for contact tracing and for risk screening. You then select submit. Apologies for the beeping out on the street there. So that's the sample collection form submitted. And then you come back and you fill in your lab request. Now in this case, we select new request. There's your unique lab request number to give to the patient. We're going to select the RDT negative, but further testing is needed. This option down here. In this case, the specimen is attached. You select the date, the time, and the lab request type. Now it's a COVID-19 swab, and again, in this case, because we are sending off a confirmatory test, you enter the type of test that you are sending. That is a nasopharyngeal swab. Could be oropharyngeal, could be nasal. If you're in hospital, it could be an endotracheal aspirate, but whatever the case, you fill that in, submit that, and that gets sent off. Always at the end, make sure you sync your data. So in summary, for every single patient, whether they've had an RDT or they haven't had an RDT, fill in the program survey and then fill in the lab request, selecting the appropriate options. If you've got any questions at all, make sure you get in contact with someone from the Ministry of Health, from CDC, or from our team on the ground, and we're more than happy to run through this in person. Even with individuals, more than happy to do this, as well as running refresher training courses as often as possible. Thanks for joining. There's more resources up on YouTube and hopefully being shared as PowerPoints. We'll see you soon.